Welcome to OEB's Overview and Highlights for the 2021-22 plan year. All the information you need can be found from the OEB homepage, oebinfo.com. There's an accordion menu on the left side with a purple icon labeled 2021-22 plan year information. Click the plus to the right of the title, and that area will open up a list of helpful links pointing you to all the rates, plan designs, upcoming webinars, and recordings of those webinars after they're over. We will also post all the video presentations, slides, and handouts from the webinars so you can access any of the materials anytime you want on demand. First things first, open enrollment will be required this year. Members will need to log in and make medical, dental, and vision plan selections if they want coverage for the 2021-22 plan year. We'll come back to this later, but I just wanted to make sure that's clear up front. EE plan management is the time each spring when OEB asks you, the employers, to select which plans you want to offer your employees. In past years, you've had to log into the admin module and make these selections for each of your employment types, and it could be a little cumbersome and time-consuming. This year, you'll be happy to hear OEB will do these selections for you. Unless you really want to do it yourself, you still can if you want. But all that is required of you is just send an email to oeb.benefits@state.or.us, put EE Plan Management in the subject line, and tell us what you want. No need to list out every employment type and every plan. Just let us know if you want everything to stay the same or if you want to change something. We'll enter your changes in the system or roll forward your previous selections from the past year. Just be sure to send us an email by June 11th so we know what you want, and we'll take care of the system side, unless of course you want to do it yourself. This is not new, but just a reminder that the surcharge on OEB double coverage will remain in place for the upcoming plan year. This was new for 2020-21, and it seemed to go pretty smoothly. We didn't hear a lot of complaints or issues about it, so I won't read this whole slide to you, but nothing has changed from last year. You can download the slides from our website and read through the details on this slide if you would like. If you're a new benefits administrator and you're not familiar with the surcharge, feel free to reach out to us. We'd be happy to go over it with you in detail. As I mentioned before, this year's open enrollment will be required, and it will run the usual dates, August 15th through September 15th for most of you. We know there are a few who close down open enrollment earlier so you can meet your payroll deadlines, and some community colleges stay open later, so we're careful to always say that in the OEB materials that go to members. We always say check with your employer, their deadline may vary. As far as our Oeb Communications to members, we will be using a very similar approach as last year, with much more digital communication, less paper, printing, and postage. I'll be sending more details out to administrators as we develop these pieces, and I'll make sample copies of them all available on the OEB website. So this is just sort of a preview into what we have planned. We'll be sending the smaller number 10 envelopes again this year, like last year, and the big color booklet will be electronic only. We will mail our usual heads-up postcard and a second postcard on August 15th, reminding members enrollment is mandatory and they do need to log in. This year, we will also make some poster designs available for you to self-print in common letter size and 11 by 17. Since we aren't sure whether classes will be back fully in person or some will still be remote teaching, we figured this would accommodate both. You can print as many posters as you'd like for yourself or none at all if you don't need them. So digging into what's new for this plan year, all the same medical, dental, and vision plans will still be available. However, there will be one new Kaiser medical plan and one new Delta dental plan available. The new Kaiser Plan 2B will have a higher deductible and lower premium, but will not be HSA compatible. That's why it fits between Plan 2 and 3 and why they named it 2B. Our current Kaiser Plan 2 will become Kaiser Plan 2A, so people can easily tell the difference. The new Delta Dental Plan will be called the Exclusive PPO Incentive Plan. As you can tell by the name, it uses the exclusive Delta Dental PPO network, and it also offers an incentive benefit structure similar to Plans 1 and 5. This plan has a higher benefit maximum than the other Delta dental plans, and if a member visits their dentist at least once per year, their benefit will increase each year up to a maximum of 100%, but they will be required to use that exclusive provider network. There is no benefit if they go out of network. Each of the carriers will discuss their new plans in detail in their own presentations. Some other enhancements to watch for in the carrier presentations. MODA's medical plans will have health navigators to help members find advanced imaging facilities, reduced copays for generic specialty medications on plans 1 through 5, virtual physical therapy visits with no member cost share, specialty behavioral health programs with no member cost share on plans 1 through 5, disease management, pain management services, including things like Tai Chi, yoga, mindfulness, and pain management education, and gender confirming facial surgery will be added to covered procedures. On the Kaiser medical plans, there's the new Plan 2B, as I mentioned earlier, as well as new virtual care options for physical therapy and obstetrics. Kaiser plans already cover gender confirming facial surgery, and that benefit will continue into the new plan year. A few dental and vision enhancements for the 2021-22 plan year. Kaiser Dental will include no copay for preventive dental visits. Willamette Dental will waive the office visit copay for any member who has not yet seen a Willamette Dental provider. So that could be someone who has just switched to Willamette Dental, or it might be someone who's been enrolled a long time and just hasn't been to the dentist. I already mentioned the new dental plan offered through MODA and Delta Dental, and both VSP vision plans will be adding coverage for vision therapy services for certain eye conditions, which you can learn more about in their presentation. And finally, last but not least, the EAP services have been enhanced and expanded for the upcoming year. You no longer need to choose how many visits you want to offer your employees. Everyone who elects the EAP benefit will automatically get up to 6 counseling visits per person per issue, plus 4 weeks of digital coaching, all for just 90 cents per employee per month. If you haven't offered EAP to your employees before, we hope you'll consider adding it this year. The pandemic has really brought mental health issues to the foreground recently, and the board wanted to make sure everyone has access to this valuable benefit at this new reduced cost. Plus, the EAP offers a lot more than emotional counseling, but I'll let you learn more about that in the RBH presentation. We'll be sending more information to benefits administrators as we move forward towards open enrollment, but hopefully this gives you a good overview of what to expect. Please watch the carriers' presentations for more details, and if you have any questions, feel free to contact us using the phone, email, and website shown here. We look forward to another great year serving you and OEB members. Thank you so much for watching.